everything. So this is a visual, right? What is this? Did anybody take a closer look? It's a little bit small when you print out the slides. Um, but what does this seem to mean? If you take it all in. So if you look in the middle, right, the determinants of health. So first you start with your age, your sex, and your hereditary factors, your genetics. And then around that, I like circular. This is a good visual for me. It makes sense to my brain. But so then your lifestyle factors, right? So maybe you're 80 and you're male and you're were born with I don't know, congenital. I'm trying to think. How about a club foot? And so you've always had a limp, right? So individual lifestyle factors. Well, despite your age and the fact that you've always had a club foot, you've been very active and eaten healthy food and have been blessed to be in an area with clean, water and air. So versus somebody who maybe lived in a third world country and was very, stressed and didn't have healthy food and water available and had a clubbed foot but couldn't get any help, and is consequently having, terrible arthritis and is, homebound. So, around your lifestyle factors, then you have your social and community networks. So how does social and community networks help determine your health? Well, you know how social factors are very important, right? Your social support and community if you live in a rural area versus a city. So think about that. Think of examples of people you know, right? So how have the people that you know or patients, how have their age, sex, and hereditary factors determined their health versus their lifestyle choices, versus their social choices and community choices or not choices, right? Maybe they're not choices, they're stuck. And then looking in the green around it, living and working conditions. Ooh, I do like this. This makes so much sense to my brain. And then around that is also general socioeconomic, cultural, and environmental conditions. So I like that visual. Okay, so this is a nice little, what's the word? Example, I guess, of determinants of health. So I'm just going to read it really quickly. Why is Jason in the hospital? Because he has a bad infection in his leg, and it's from a child. But why does he have an infection? Because he had a cut on his leg and it got infected. But why does he have a cut on his leg? Because he was playing in the junkyard next to his apartment building and there was some sharp, jagged steel that he fell on. But why was he playing in a junkyard? Because his neighborhood is kind of run down. A lot of kids play there and there's no one to supervise them. But why does he live in that neighborhood? Because his parents can't afford a nicer place to live. But why can't his parents afford a nicer place to live? Because his dad is unemployed and his mom is sick. But why is his dad unemployed? Because he doesn't have much education and he can't find a job. But why? So you can see this is a nice example of how, what do you see when the child gets admitted to the hospital? A little boy with a cut on his leg who was playing in a junkyard unsupervised, and now he's got a bad infection. So you think, maybe you make a judgment. Why? Maybe from a nurse's perspective, you say, why? Why wasn't someone watching this kid? What's going on? But there's always more of the story. And what determines his health? Is it that he, you know, what determines the child's health? Is it that he just needs some antibiotics and he'll go home and be fine? No, there's a lot more going on. Maybe his parents can't afford the medication. Okay, moving on. So, understanding the concept between risk factors that can be changed, reduced, or not changed, right? So can you think of examples of that? What risk factors that have to do with family history or personal history can be changed, what lifestyle choices can be changed or reduced, and what can't be changed, right? If you're born with, a genetic mutation, there's nothing you can do to change that. It's in your genes. But if you have a family history of alcoholism and you know that, then what can you do? You can be very careful to not use more than in a social way, because, or maybe I have people in my family from generations back that were terrible alcoholics. So there were some, like my grandparents, aunts and uncles, that never drank because they saw what alcohol could do. They never had one sip. Nope, I don't even want to try it because Uncle so and so was scary. So I'm sure some of you have those stories as well. Okay, so in the book, on page 40-ish, yeah, 40 through 43, I think. Oh, 44. It talks about theories of human behavior, right? So these are different theories. These are not our nursing theorists, but these are scientists and theorists who created different theories to describe and predict human behavior. Okay. Oh, there's the page. It's right there. So, why do people behave the way they do? What motivates people to look after their health? Why do some people take care of their bodies and do their screenings and go to their doctor's appointments and others don't? So, these are interesting, but complicated, right? And one paragraph is not going to get you enough knowledge to really, or it didn't get me enough knowledge to really understand it and be able to apply it. There's some graphic figures for you to look at as well to see kind of an example, and that to me makes complete sense. But these are, outside of nursing. This is very health promotion related. So the one that you need to pay attention to is it's the one with the most ridiculously long name, the trans theoretical model of behavior change. So what is that? It's valuable to help understand why individuals do or do not become involved in making a health behavior change, in evaluating their personal situations, and in tailoring efforts and strategies according to each individual stage of change, right? So why do we care about this? And this is on page 45. I just read that little mini paragraph. Why do we care? Because if we go in and we have a patient who cut their finger off, and if you don't smoke, the surgeon will offer to sew your finger back on. If you do smoke, the surgeon will say, no, you are not a candidate for a replantation of your finger because smoking causes vasoconstriction and the surgery takes 12 hours. And once it's on, if you go out and have a cigarette, your vessels will contract and you will lose that finger and it will be amputated. So we're not going to spend however $500,000 and all these supplies and time to sew it back on if you're not going to make that change, right? So if you say that to the patient and they say, yeah, no, it's not time for me to quit. I just bought, 4 cartons. And so you've assessed, right, what stage of behavior change they're in. And so for this patient who says, I just bought 4 cartons, he would be in stage 1, which is pre-contemplation. He's not even thinking about making a change. He's not contemplating it. There's no action planned. Nothing's happening, right? So why would you offer smoking cessation teaching? It'd be a waste of your breath. Why would you offer them, a surgery that can't be done when you smoke? It's not even where they are at, right? So that is very functional. So you are assessing where they are in their ability to change in order to formulate the best plan for the patient. So you can put a big star and circle this slide because, as you'll see on your test blueprint, there are a couple questions on this. It's very straightforward. I know you can do it, right? So pre-contemplation, we just got an example of that. Contemplation is when you're thinking about it, but you haven't taken any actions. So yes, I know I need to quit smoking, but it's the summertime and that's when I drink beer and go fishing with my buddies, and I'll think about it, in a couple months when school starts and my kids go back to school, right? So they're willing to talk about it, but there's no sense giving them Nicorette gum yet, right? So then preparation is, okay, now it's August 1st and school starts September 1st. So, I guess I should not buy another carton of cigs. I'm trying to think of, I don't even know any of the brands anymore. Pall Mall, no, Camel, that's a good one. I don't want to buy another carton of Camels. So, and gosh, I looked at the price of Nicorette gum and Chantix. Maybe I'll go see my doctor and talk about, options because it's almost time for my quit date, right? So they're preparing.